Hi, this is Dr. Praneeth, pediatric and neonatal intensivist from Pratima Hospital, Kachigoda. Today, let us see something about cough. So, usually this is a season for cough and cold, that is October to December. So, what is cough? Cough is actually a symptom, right? It's not a disease. So, what usually parents think is, sir, my child is coughing a lot, he's not able to sleep properly. So, let us see what actually cough is. So, usually parents interpret cough and cold as something the child has and it is making him suffer a lot. In fact, cough is actually a protective reflex. So, anything which happens from nose till the lungs, anything, cough usually tries to remove it from that system, that is the respiratory system. So cough is actually a protective reflex rather than a disease per se. So actually cough is a symptom rather than a disease. Okay. So what is cold? Cold is something usually in normal language we say it as nose block or nasal discharge. So as a physician, how we see cough? Cough is of two types. One is dry cough, second is wet cough. Anything within the lungs is usually wet in etiology. Anything from nose, that is upper airway, is usually dry cough. So why is it important to know whether it is a dry cough or a wet cough? Yes, it is important because usually dry cough, it's mostly upper respiratory infection, most commonly the nasal discharge. Most common etiology for any cough or cold is viral etiology. Out of 100%, 80-85% will be out of viral etiology. So second thing, wet cough, most commonly the lung issue. So you have to see whether there is any lung complications that are actually there causing that cough. So example, you can give an infection or an allergy and an asthma. Both have cough. Both you get a sputum like thing. So when you see a cough which is seasonal, dry in nature, and it's not troubling the kid max, so most commonly that will be an upper respiratory cough which stays with the kid for some time. Usually it takes 2 to 3 weeks for that cough to come down. The best medicine for that cough will be to just give some steam inhalation and give some home remedies like honey with ginger. And if the cough is troubling the kid, then you can use mucolytes, cough suppressants and all those things. So okay, let's come up to cough. So as a physician, how we see cough, we usually ask some questions regarding how that cough is, whether it is actually so the onset of cough. So onset also matters. So whether the cold has started first, followed by cough. So it suggests that there is some amount of postnasal drip in the history itself. Second thing, the timing. The timing of cough is whether the cough comes early in the morning with some wheezing difficulty, the child is not able to sleep, is rolling over and all. So that suggests that there is some amount of reactive airways, that is your asthmatic and all those things / a nose block. So that is one more thing. Second thing, you can say cough. A child is coughing, but during night he doesn't cough. Daytime he coughs. That is usually we tag them as an habit cough. Fourth thing, a child who is mouth breathing with recurrent respiratory infections, with open mouth, snoring, all those suggestive of an adenoid hypertrophy. So in this way, we usually with some few questions we know what type of cough it is, what is the source of cough. So for an asthmatic, usually it is seasonal. You give them some nebulizations and all to reduce that wheezing thing. So second, for an adenoid, you have to look out for the adenoid hypertrophy thing. For reactive airways, nebulization. For a normal common cold, the best medicine is to give them a nice steam, a hot soup, and a natural cough remedy like a honey with ginger. There are so many things like camphor, smell of a camphor. Third thing, you can give some turmeric milk and all those things, where if that cough is troubling the kid in say, then you can give them a cough suppressant. But before giving a suppressant or a mucolite or an antihistamine, make sure the child is actually having difficulty with that cold and cough rather than giving a medicine, because the more we use those medicines, we are actually, it is just a temporary relief for the child, that's it. He's going to get it more, how do you say, he gets it again and again, because that is the way, nature's way of providing immunity to the kids. So try not to rush unless and until that cough is significantly troubling, like the child is not able to sleep properly, child is not able to do his routine works like sleeping, eating and playing. So that is an indication to tell that the child is actually having difficulty with cough. Then it makes sense for us to use a cough medication like this. Thank you.